Hello, good morning. My name is Amabala Lishafora Austin. I am a student of the CISIC School of Nursing at the University of Texas Health Science Center at Houston, and I will be discussing for this presentation affecting population health by disseminating health information via social media. What is social media? Social media is an internet-based form of communication. The social media platforms allow users to share information, create web content, and have conversation with each other. There are many forms of social media including the photo sharing sites, instant messaging, and network sites. What are the types of social medias available? We have social media networking sites like Facebook. We have picture sharing sites like Instagram. We have video and sites like TikTok, and we have instant messaging sites like WhatsApp. And also we have learning sites like YouTube, which also is a video sharing site. Why use social media? According to the NIH, 80% of patients are using the internet, therefore using social media and blog sites to get healthcare information. This shows that healthcare providers can give patients good information on their health on social media. What are the benefits of using social media in population health management? Social media use has been increasing in population health management and health promotion because it has been shown to remove geographic barriers and physical barriers in patient information management. It has also been shown to be a low-cost way of passing information. What is population health management? Population health management refers to the process of improving clinical outcomes of a defined group of individuals through improved care communication, and patient engagement. Patient Population health also deals with the health and outcomes of the particular group of individuals. Examples of using social media to better improve patient engagement. I know we all remember the ELS challenge, bucket challenge that happened a couple of years back. After this challenge, research shows that a lot of people actually that didn't know about ELS did more research about it, learned more about it, and spoke to their doctors about it. Another way of improving patient engagement using social media is by using discussion forums for public education. These forums can be interactive, which affords the patients and the doctors to interact on social media. I know my doctors do something they call the fireside chat, which gives us opportunities as patients to discuss our health with them. Without healthcare professionals in the group, there are some patients that have Facebook groups or groups where they have what they call a social comparison. Social comparison is a situation where the patient compare themselves with their peers that have the same issues and on how they suffer and cope with their conditions, like fertility groups and such. Look on your hands. How many of you are wearing a Fitbit, Apple Watch, any other of those sports watch that will tell you your heart rate, that will tell you that what's going on in your body, how much you sleep. This way has also been used for patients to engage their doctors or their faith or their groups to talk about their health. Many people feel anxious about visiting doctors, especially for issues like mental health, but using social media can help them realize they're not alone. When they're in groups or when there are campaigns that shows people that have the same struggle and that help is available, this will drive people to see doctors or healthcare professionals to help them. These are actual examples on how social media have been used for health promotion. In 2009, on World No Tobacco Day, there was a campaign, hashtag I Quit Tobacco, that was created for 21 days, give patient tasks to help them quit tobacco. After those tasks, it was shown that people did quit. Also in 2019, the Action for Suicide Prevention created an online contest on Instagram that Buddies for Suicide Prevention. This online contest was intended to engage the public to join hands for working towards suicide prevention. This campaign included several categories to assist that. The painful truth. was an online campaign launched on Instagram and Facebook. This campaign was a cooperative effort to break the stigma around migraine. On each day during this campaign, a myth and misinformation about migraine was shared, and also related information about it was shared, teaching people about migraine. Of course, there are drawbacks to using social media as health promotion and health and patient engagement techniques. These drawbacks include lack of privacy, misinformation, and the risk of low resources patients not being able to access social media. We will discuss that in the next couple of slides. Lack of privacy is one of the biggest issues and biggest drawbacks of using social media for health promotion. As patients and healthcare professionals will be discussing on social media, there may be issues with social media breaches, which patients will be scared of and will not let them participate fully or commit fully to the healthcare information that is being passed along to them. Drawback will be misinformation online. Anybody can claim to be whoever they are and be spilling wrong information on social media. This can cause patients to get the wrong information. I recently just heard a situation where someone was looking for treatment for cancer and they were told to drink online urine of camel that can cure cancer. Information like this harmful. Drawback is that although there's promise that social media can improve patient outcome, but unfortunately for patients with low resource and low socioeconomic status who may not have access to internet or access to social media, they may not get all this wonderful information that is being passed across on social media. Based on a few examples given in this presentation, it has shown that social media can indeed improve a health of improve the outcome of a population, but unfortunately, it does have its drawbacks. The drawbacks do need, especially privacy, need to be looked into to make this work. Thank you for listening to this presentation. I hope you had fun listening and you learned something just as I had fun researching and presenting this presentation to you. I am open for any questions. I can be reached via email, nursemotiat@gmail.com. Thank you. Have a good day. Bye bye.